Good afternoon, everybody. Welcome to this afternoon episode of Pursue. And after a small break, we are back with our general pathology and immunology lectures. Today we have Pursue 5N and we are streaming live from Kolkata. And today's topic is immunity and hypersensitivity. And today we shall be dealing with hypersensitivity reactions 1 and 2. And to talk on this, we have Dr. Major Palash Kumar Mandal, who is an MD and Associate Professor in Pathology at Sagore Dutta Medical College, Kolkata. He's also a Lab Director in Desun Hospital and Heart Institute, Kolkata. Before I ask Dr. Mandal to start, let me request all of you to please keep your mic muted, your camera off, and please don't share your screen. Yeah, Dr. Mandal, please share your screen, sir. Right. Can you make it full screen, please?
Yes.
You can just press that hide so that that pop-up can just go away. Yeah. Thank you so much. Please start.
Good afternoon, everybody. So we are back with general pathology, the lectures which we were dealing with previously. Unfortunately, I had got this COVID-19 infection and I have recovered, and so I am able to come before you and present once again the lectures. Thank you, sir, for allowing me to take these lectures once again. So, as sir has already informed you that we will be discussing immunity in the following lectures today, and coming one or two more lectures I will be taking. So we will be covering the immunity topic along with hypersensitivity reactions 1 to 4, and also something about the autoimmune diseases and especially HIV/AIDS. So these topics are quite relevant, and as you know, immunity is one of the most important topics, in a sense that these diseases are called uh, incurable diseases. Why, we will discuss it later on, but we will start with it, the basics, and we will be discussing today the introduction of immunity along with only hypersensitivity 1 and 2. These immunity, as you know, is a broad topic, and it not only is a part of pathology, it is very much a part of microbiology as well. So for the undergraduates, I am telling you, so this topic will be covered by both these subjects, and each one will have a more elaborate discussion on their particular portion. And to begin with, we will have a brief introduction of these terminologies, which are very important to understand before we start with immunology. So first is antigen. So we will be coming across this term quite often. Now, what is an antigen? An antigen is a substance, usually protein or a part of protein, which when introduced into the tissues stimulates antibody production. So antigen will always lead to production of an antibody, which is produced by the host or the body itself. Now, what is antibody? It is a protein substance produced as a result of antigenic stimulation. So whenever there is an antigenic stimulation, that whenever an antigen is introduced in the body, so in a host will respond to it by production of a antibody. So circulating antibodies are also known as immunoglobulins. You will be discussing, I think, in broad details in microbiology class. So I am just naming them. I am not going into the details of immunoglobulins, and they are of basically 5 types: IgG, A, M, E, and D. Okay, so and antigen will always react with antibody, because an antigen produces an antibody which will have a same which will only act against that particular antibody. It's very, very specific. So antigen, a particular antigen will produce a particular antibody against that particular antigen itself. Okay, so antibodies are not uh, common antibodies. Like antibody against tuberculosis will not act against antibody for COVID-19. Okay, it's something like that. Now, antigen and antibody, when they combine, they form a complex. It may be demonstrated by reactions, which is again a part of microbiology, and they may be primary reactions, they may be secondary reactions, and these can be demonstrated. These reactions, they have various names: agglutination, precipitation, immobilization, lysis, complement fixation. All these are demonstrable, and they can be demonstrated in vitro, and this is one of the basis of the detection of antibodies in our body against a particular disease. Any disease, whether it be a viral infection, whether it be a bacterial infection, we can detect the presence of antibody which has been produced against that specific microbe, and we can demonstrate it in a form of reaction. That is, it may be immunoprecipitation reaction, it may be a ELISA reaction, which is the full form is enzyme linked immunosorbent assay. Or if we are not able to detect the antibody, or we are not we do not want the antibody which is produced little later, we want the antigen to be detected, then of course we will have to go for some sophisticated tests. Again, ELISA we know is one of the tests, and more sophisticated tests like PCR, which is polymerase chain reactions, and other tests. So these tests can directly identify the antigen. So we are not going into that. Now there is a term called hapten. So what is hapten? It is a non-protein substance. You see, antigen, antibody, they have protein component in them. So now what is a hapten? Hapten is a non-protein substance which has no antigenic properties of its own, but when it combines with a protein, it forms an antigen. So it's an incomplete antigen. If you have to remember that way, it is an incomplete antigen. So whenever it attaches itself to a suitable protein, not all proteins, it has to attach itself to a suitable protein, then it develops some antigenic property. And if you, by antigenic property, we mean that it will be able to elicit a antibody production in the host. Okay. Now immunity. So this term immunity is a very broad term. Immunity means the immunity is the basis by which we fight against all the invading microbes or foreign substances which come to our body. So that is the basis of immunity. Immunity means resistance. Immunity means you have the power to fight against what? Against these, all these enemies, the microbe, the bacteria, virus, etc., etc. And the basic thing is that a person who has got more immunity is able to fight a disease better. A person who has got less immunity because of disease, because of certain other reasons like some malignancy or some drugs, like a person who is taking long-term steroids or something, their immunity is usually rather a little low, and these persons can be affected by a disease very easily. Okay. And not only affected, but the disease can overpower them. The disease can be so dangerous at times that it may take the life of that person also. So that's why immunity is very important. Okay. And based on this immunity, you have to understand this whole topic of the coming few lectures we will be discussing. This is the whole this is the basis of everything. So Broadly, immunity can be classified into two things. One is innate or natural immunity, and second one is adaptive or acquired immunity. Okay, so innate immunity means from the birth only these things are there in the body, and you do not have to generate anything to do to protect us. Okay, so one is the epithelial barrier, where is very normal. So we have skin. So skin is a first thing which will stop a microbe from entering our body, isn't it? So it is the layer which is covering our whole body from head to toe. We are covered by a layer of skin, and that is a portion of innate immunity. Then comes the phagocytic cells. There are microcytes, microcytes, and macrocytes. The microcytes are the immediate acting cells. Those are the neutrophils. Okay, so they are the first lines of defense. And then we have macrophages. They are also the defense cells, but they come a little later on when the infection keeps on continuing. Okay, these are the phagocytic cells. So we have discussed about macrophages and all that, so I'm not going into details. Then we have something known as natural killer cells, part of lymphoid cells, and also dendritic cells. Dendritic cells, which are again a part of immune system, but they help in recognizing a particular antigen, and they are also known as antigen presenting cells, which will present the antigen to the particular immune cell, which will act then. Okay, then comes certain plasma proteins. Plasma proteins, proteins like components, complements, IgM. These plasma proteins also are the antibodies which will protect us, and by various mechanisms they will uh, attack the microbe and try to eliminate or try to neutralize them. Okay, so this is the innate or natural immunity which is present from the very birth in a particular person. Now coming to adaptive or acquired immunity, so they are activated only when there is some antigenic I can say injury. That is, an antigen whenever enters a body, then this type of response is elicited in the body. For that, the cells have to be present. So the adaptive immunity also depends on innate immunity. If these immune cells, the T cells, the B cells are absent, then there will be no adaptive immunity, because there will be no response generated from the body itself. So for that also, for acquired immunity, the innate immunity should be intact. The basis of adaptive immunity is the intact immunity, innate immunity. Okay, and as you know, the organs of immune system, there are two basic divisions. One is the primary organs, one is the secondary organs. Primary organs are the thymus and the bone marrow, where the thymus where the T lymphocytes are generated, and bone marrow where B lymphocytes are generated. So that is called the primary organ of immune system. Now what are the secondary organs? They are the lymph nodes, the spleen, the mucosa associated lymphoid tissue. So these are the secondary organs. Okay. Now this is a picture taken from Robbins. So this shows how, I mean, this immunity is activated. This adaptive immunity is activated in the body. This is a simple image which shows the B cells, the T cells, and cytotoxic T cells. So here what is seen is that a B cell, whenever it reacts with a microbe, when a microbe is when it comes in the body, a particular B cell is activated, and the B cell is transformed into a plasma cell. This plasma cell transformation is very, very important, because only once the B cell is transformed into a plasma cell, it can produce the antibody. So antibodies are produced from modified B cells, which are known as plasma cells. So that is the basic thing. Okay. Now coming to T cells. T cells, as you know, basically CD4 cells are the helper T lymphocytes and CD8 cells are the cytotoxic T lymphocytes. So helper T lymphocyte will only act when the antigen is presented to it through a antigen presenting cell. Okay, so this phagocyte or the macrophage here, it acts as a antigen presenting cell. So like when you eat with a spoon, the spoon acts as a antigen presenting or the food presenting substance or the food presenting material to the mouth. Okay, so similarly this T cell, it will only recognize an antigen which is presented to it. It will not take up an antigen on its own. It will only recognize an antigen when an antigen presenting cell, which is known as APC, which can be a macrophage, which can be a dendritic cell. So these categories of cells, whenever they present that antigen, they will act and it will produce some cytokines. So these cytokines will then act against the a substance, a microbe, through various ways. So one of the ways, activation of the macrophages. So macrophage here was acting as a APC, but here the macrophage has transformed itself by action of these cytokines and is now ready to pounce upon the antigen or the microbe and kill it. That is phagocytosis. Then comes reaction or inflammatory reaction by attracting more inflammatory cells and trying to kill them. And third is the stimulation of more B lymphocytes and production of more antibodies so that the antibodies can coat the antigens and eventually neutralize them. Okay, and finally phagocytose by the macrophages. So this is a schematic diagram. Sorry. The last one is cytotoxic T lymphocytes. The cytotoxic T lymphocytes do not need any, direct, they can act directly on the infected particular cell which is containing a microbial antigen. Okay, so they can directly attack and they can lyse. So that is why they are called cytotoxic. They can directly kill a particular cell which is infected. Suppose a virus has infected the epithelial cell and the epithelial cell is full of virus, now the cytotoxic T lymphocyte will go and attack the epithelial cell, so it's destroyed, and along with it the virus will be also destroyed. So that is the aim. So these are the various ways how T lymphocyte can act. So this is also one of the ways. This is known as cell mediated immunity. So we will be discussing cell mediated immunity later on. So I am not going into details. So how they are doing the killing and all, these are discussed inside this hypersensitivity reactions as well. So I am not going to details. This is just that these T lymphocytes and CD4 lymphocytes and 8 lymphocytes, how do they kill? Similarly, this humoral immunity we just discussed. So basically, one point which I want to highlight is there that even though B cell can independently act and neutralize a protein that is an antigen by production of antibody, but the most important thing is that, as I told you, is the transformation of B cell into plasma cell. Okay, there has to be transformation. B cell by itself cannot do antibody production. It has to transform itself into plasma cell, and this transformation is triggered or activated by this CD4 T cells. So you have to remember this. Without T cells, even B cells won't be active. So this whole immune system, T cell is known as the bandmaster of immune system. Okay, so you should know this because T cells they act in a different way. B cells they also act in a different way. Humoral immunity, cell mediated immunity, but even for humoral immunity, T cells are required. So this is what I wanted to highlight. And eventually, humoral immunity. In humoral immunity, there will be neutralization of the microbes, phagocytosis, and all these things will be there. But T cells are very important for even humoral immunity also. Now coming to the hypersensitivity reaction. Like what I was telling you, like immunity is very important for our body, because without the presence of immunity, we will not be able to fight any organism, isn't it? So immunity is important, but there is a catch. So this immunity, if it is expressed in an altered fashion, or suppose the antigen is there, and instead of producing an antibody against that particular antigen, immune system produces antibody against some other organisms, or immune system produced antibodies against body's own cells, then there is a catastrophic reaction. And that catastrophic reaction is the basis of a host of diseases known as autoimmune disease. Similarly, hypersensitivity reactions are also exaggerated response of exaggerated immune responses. Okay, so these exaggerated immune responses at times become detrimental for the host itself. Am I clear? Immunity is good for the body, but excess immunity is not. So hypersensitivity reaction is a kind of immune reaction of the body to a particular antigen, and that is not wanted. So what is the definition? By definition, the hypersensitivity is a repeated exposure of the same antigen in a sensitized person leading to a pathologic reaction is known as hypersensitivity, or in a way exaggerated immune response. Okay, so what there are certain terms. There should be repeat exposure. That means once antigenic exposure has happened, it may have elicited some amount of reaction, but the same antigen, if it is presented again to the body, that is the host, there will be a exaggerated response, which is not common, which is not a normal thing for all the people, but in some individuals it happens. Who is a sensitized person? Sensitized person means who has already experienced the antigenic exposure. That person is known as a sensitized person. Anybody can be anybody can be a sensitized person, because anybody who has had a previous exposure becomes a sensitized person. Like suppose in my case, I have been I have just recovering from COVID infection, so I am a sensitized person towards COVID-19. So I have developed some antibodies for against this virus. Okay, so repeat exposure, normally what it does, the antibodies which are already there in the body, they try to protect. That is the normal reaction. However, instead of the protection, if there is an exaggerated response, there is an excessive immune response which leads to destruction of the host tissues, or host tissues in fact, so that is known as a hypersensitivity reaction. Okay, am I clear? Because this understanding is very important, because hypersensitivity is known as a double-edged sword. Understand? So immunity is a good thing, as well as it can produce some deleterious effects as well. Now, imbalance between the effector mechanisms of immune response and control mechanisms. So there is a word called control. So you have to understand. So whenever In the initial reaction, whenever we talked about inflammation, what did we tell? That after the process of inflammation is over, there is no further response. That means at one point the inflammation should stop, go away, isn't it? So whenever the antigen was introduced, so there was an inflammatory response, and that inflammatory response had to go away after a certain time. But if it continued, either it became a chronic inflammation or it led to some destruction in the local tissue. So that is called the imbalance between the immune response and the control mechanism. Now both exogenous and each word is important. You have to understand this. That's why I'm very slow. This of 5-6 lines I'm just going very slow. Both exogenous and endogenous antigens may elicit the reaction. So what does exogenous mean? Means something which has come from outside the body. That is exogenous. Now, endogenous means all the antigens of our bodies are endogenous. So what can be an antigen? So any protein. Our body has lots and lots of protein. The whole system is made up of protein only. Protein, fat, and all these have got specific antigenicity. Understand? For example, I will tell you the RBC has got the blood group antigens. So somebody has a blood group A, so that person will be having antigen A antigen. So similarly, another person might be having B blood group, so antigen B will be present on the surface of the RBCs. So similarly, there are lots and lots of antigens on all the cells of our body. And if by chance the normal reaction is that the body from the very beginning does not produce any antibodies against body's own antigen. That is a normal reaction, and we will, when we discuss about the autoimmune diseases, we will discuss how there is this antibody silencing takes place. So at the peripheral level, at the central level, so the body never produces antibodies against its own antigens. Okay, so but if this immune mechanism or immune silencing, there is a disturbance in that, so the body may start producing antibodies against its own antigens and endogenous antigens, and that leads to the reaction which is known as the autoimmune reaction. Autoimmune, self immunity, means antibodies produced against self antigen. Okay, and the hypersensitivity, for hypersensitivity reactions, it may be inherited. We will see the type 1 hypersensitivity reactions. The persons who suffer from that are known as atopic individuals. So it is inherited. A person having it might transmit the same thing to his progeny, his children. So that is how that is inherited. Okay. Now the basics, I will not go into details, just a few words about these immune cells. T lymphocytes, develop from the precursors in the thymus, and most of the mature cells in the blood are T lymphocytes. Okay, almost 60 to 70% of the lymphocytes are T lymphocytes. The rest of the lymphocytes are B lymphocytes. That is 30 to 40% are B lymphocytes. Okay, so T lymphocytes are present in the blood as well as in the peripheral lymphoid organs or the secondary lymphoid organs. So they are, where are they present? They are present there are specified areas where T lymphocytes are present. When you study the structure of a lymph node, you will be knowing that. I'm not going into details because it will take more time for that. So, and the important thing is that each T cell In discussing with immunity, each T cell recognizes a specific cell bound antigen by means of an antigen specific T cell receptor. This is very important, you see. So there has to be a T cell receptor, and this T cell receptor will only recognize a specific antigen which is specific for that receptor. So this is very, very important. And T cell receptor recognizes a peptide antigen that are only displayed by MHC molecules on their surfaces of the APCs. Okay, so what are MHC molecules? The major histocompatibility complex molecules. They have alpha chain, they have a beta chain. This is the MHC molecule. Okay, now this is a T cell CD4 lymphocyte, and this CD4 lymphocyte, that is, it has got certain proteins. Now MHC molecule, when it presents a peptide antigen, that is only recognized by specific receptors or TCRs, T cell receptors. Okay, so this whole thing is the antigen presenting cell. An antigen presenting cell has these molecules, and through these molecules it will present the peptide antigen to the CD4 cell. Okay, so this is important for understanding. This picture is given in Robbins, so you can go back, look into your book, have a better understanding, because that is given in details over there. Due to paucity of time, I am just covering the small things. Okay, and this specificity is very important. Like every T cell will not go and attack every antigen. So antigen has to be specifically produced or presented by a APC, and this antigenicity is also limited by major histocompatibility complex, which is known as MHC restriction. Okay, this particular thing is very important, because otherwise if you don't understand this restriction, then you will not be able to comprehend why all T cells do not go and attack a particular antigen. So this particular thing is very important. Okay, B lymphocytes. As I told you, almost 10 to 20% of the circulating peripheral lymphocyte population are B lymphocytes. In fact, a little more. It may be a little more than that also. And they are also present in the lymph nodes, spleen, mucosa, and the B lymphocytes are in the lymphoid tissue. They are the majority. Okay, the germinal center and everything is composed of the B lymphocytes. And as like T lymphocytes, these B lymphocytes also recognize the antigen by the B cell antigen receptor complex. So there is a B cell receptor antigen complex also. So this is the antigen, and this is the immunoglobulin IgM. So this is the receptor complex, and it is presenting the antigen complex to the CD21, that is a B cell. Okay, so this is presenting this IgM, that is the immunoglobulin. This is the receptor and it is presenting the complement, presenting the antigen, and there is a complement component also, and this recognition is done by the CD21, which is a B cell. Okay, so you see all these cells will only recognize antigens when the antigens are properly presented to them. Now, not at random, they have to be presented to the immune system. The immune system comprises of these T cells and B cells, and then only they will be able to act. And further, as I told you, these B cells, not only this presentation will do, the B cells, if they have to act and produce an antibody, they will have to be activated further, and that activation has to be done through certain cytokine signaling by T cells only. Okay, now there is a third category of cells, that is a dendritic cells. The dendritic cells and the macrophages, they are the APCs or the antigen presenting cells. Now, dendritic cell, there are two types of dendritic cell actually, though the morphologically they have some similarity. That is, they have lot of like a fibrillary processes from their cells. So that's why they're called dendrites. They look like the neurons, but they are of the different category. So these first type of cells are the macrophage related cells, also known as the interdigitating dendritic cells. Okay, so they are present in the skin, they are present in the mucosa, and they produce whenever some antigen enters in the body, they go catch hold of the antigen and immediately present it to the particular immune cell, so that immune response is generated. Okay, so they will produce it primarily to the T cell. Understand? The other type of dendritic cell is actually a follicular dendritic cell. It is not actually, follicular dendritic cell is actually not a APC. The follicular dendritic cell has got a different function. It is usually present in the germinal centers of the lymph nodes, lymphoid follicles in spleens and lymph nodes. Okay, so there it basically serves as a macrophage function. It eats up the debris, the whenever some these cells are dying, the lymphoid cells are dying, that eat it up. So they are the follicular dendritic cells. Coming to type 1 hypersensitivity reaction. So type 1 hypersensitivity reaction is also known as immediate hypersensitivity reaction, and commonly it is, the common example is allergy. Okay, so what is it? It is a rapid immunological reaction which is occurring within minutes after combination of the antigen with antibody, and it is bound to mast cells in sensitized individuals, leading to the reactions like itching, hives, respiratory distress. Hives is like swelling in the skin, like formation of wheals. So those are also known as hives. Okay, so basically it is an immediate reaction and it occurs within minutes. You have to know each word is important. Within minutes after the combination of antigen with antibodies. Where are the antibodies? Antibodies are bound to the mast cells. Okay, we will come to it. So how it is combining and everything, we will come to it. And it happens in sensitized individuals. Sensitized, we have already discussed. A person who has been previously exposed to a particular antigen is known as a sensitized individual. And how does it express as a reaction? It expresses as itching, wheal formation, and even respiratory distress. So as you can understand that this reaction is not a good thing to happen. This immunological reaction is not a good thing, because once a person is experiencing respiratory distress, itching, is it good for the person? No. So that is why it comes in the category of hypersensitivity or exaggerated immune reaction. Fine. Now this is an antigen and this is a dendritic cell, which is a APC. As I have already told you, APC has to present antigen to the CD4 lymphocyte. The CD4 lymphocyte, now there is a cytokine, that is interleukin 4, that acts upon this CD4 lymphocytes and transforms it into Th2 type of cell, which is again a subcategory of CD4 lymphocyte. Okay, now CD4 lymphocyte has got Th1 type population, Th2 type population, and in that particularly type 1 reaction, the CD4 cell, when it is acted upon after the presentation, it is acted upon by the interleukin 4, it transforms itself into Th2 cell, which also leads to more production of interleukin 4, interleukin 5, and interleukin 13. And what it does then, this interleukin 4 also stimulates the B cell to produce this transform into plasma cell, and it will produce the specific type of immunoglobulin, that is IgE. Okay, so you see the whole reaction is like this. Initially, the antigen was presented through APC to CD4. The CD4 lymphocyte got transformed into Th2 cell with the help of this existing IL4. This this Th4 led to production of interleukin 4, 5 and 13, and of which interleukin 4 led to stimulation of the B cell into plasma cell producing specific type of immunoglobulin E, IgE. Okay, now that resulted in some local response and some systemic response, and that is also divided into some immediate phase and late phase. Now, first was this production of antibodies. This was till the first phase. Okay. Still now, and hypersensitivity reaction has not taken place. Just the antibodies have been produced in the first phase. Now, whenever the repeat exposure happens, what happens? The repeat exposure leads to this IgE. What they do? Why do they go and attach themselves to certain cells known as the mast cells? Mast cells are also known as tissue basophils. They have lot of granules in them like basophils, and these granules lead to lot of reactions. Okay, so tissue basophils are known as mast cells, and these IgE which was produced by these B cells, that is plasma cells, they go and attach themselves to the mast cells which are present near the mucosa, near the blood vessel, in the tissues basically. And whenever there is a repeat antigenic exposure, the same antigen which was there, this particular antigen, when it came again and it came in contact with the mast cell, the mast cell got activated. Mast cell got activated, and this activation led to degranulation. That is, my mast cell started releasing granules, and all these granules, one of these granules, there's phospholipase A2. There are certain enzymes like protease. There are cytokines like TNF, that is tumor necrosis factor, and interleukin 1, vasoactive amines like histamine, lipid mediators like prostaglandins, leukotrienes, platelet activating factor. All these granules, all these mediators are stored in the mast cells. Okay, all these are they're present in the mast cells, and the degranulation led to a burst of this enzyme activity. Okay, so there is a reaction, and the result of the reaction is the immediate phase. That is, immediately what happens is that within minutes there is increased vascular permeability due to primarily histamine, vasoactive amines. Okay, smooth muscle contraction by this prostaglandins. Okay, prostaglandins and leukotrienes, they lead to smooth muscle contraction. Increased mucus secretion by the cytokines, leukotrienes. Okay, so these lead to increased mucus secretion, and this is known as the immediate phase. Gradually, when the immediate phase goes into a late phase, that is after 24 hours also, the inflammatory cells, they start collecting, and they collecting at the site of reaction. As we have studied in the chapter of inflammation, these cells, that is the eosinophils, neutrophils, basophils, T cells, all these cells start coming, and predominant cell is the eosinophil. For type 1 reaction, the most important cell is the eosinophil, and the immunoglobulin responsible is the IgE type. Okay, and eventually leading to epithelial damage. So, who are damaging? The enzymes, the proteases are there, the phospholipases are there. So, they are damaging the cells. Understand? So, they are damaging the cells. And there is bronchospasm. these prostaglandins lead to smooth muscle contraction. The smooth muscles of the bronchus, they become constricted and there is bronchospasm. So that leads to respiratory distress. Okay, so this is very important. You have to understand this, that initially a particular antigen in a sensitive is presented. The person is basically, you have to understand that atopy does not happen in everyone. Even if a second antigenic exposure happens in some person who are not prone to develop this disease, they will not develop. Only persons who are actually prone to develop, so they are what did we say, they have got this HLA link inherited. This HLA link is there, so they are genetically predisposed individuals. So in a genetically predisposed individual, whenever a second exposure happens, so that leads to this culmination of these events. Okay, am I clear? You can go back, read up. If you still have any doubts, you can come back to us, to this group. I will be able to answer you. I shall be happy to answer your questions. Okay. So which are the conditions associated? This is commonly asked in the Viva also. So what are the diseases? So since we are dealing with medicine, so always we have to remember the practical examples, the diseases, the names of the diseases which are associated with a particular condition. So type 1 hypersensitivity reaction, if you are asked what are the examples, what are the conditions which are associated, so commonest example is the bronchial asthma, systemic anaphylaxis, urticaria, hay fever, and atopy is a susceptibility in genetically determined. So atopy, this susceptibility is genetically determined. Okay, so this particular thing you have to understand. In some persons who are not genetically determined may also show some reactions, but the persons who are susceptible, that is genetically who are susceptible to particular these antigens, so they will be showing this exaggerated response. Fine. Type 2. Type 2 hypersensitivity reaction, it has got 3 divisions. Okay, first one is the how antigen is acting. The method is by opsonization and phagocytosis. Second one is by inflammation, and third is one by antibody mediated cellular dysfunction. So these reactions are basically what? These are basically immune reactions. Immune reactions of against an antigen. So how our body reacts against an antigen, this is a hypersensitivity reaction. But why hypersensitive? Because the immune reaction is exaggerated and destructive in nature. That's why we have that's why they have come under this terminology, hypersensitivity reaction. So this type 2 hypersensitivity reaction, in first category, what do we see? The opsonization and phagocytosis. So whenever an antibody is produced against an antigen, so there is a combination of antigen and antibody on the cell surface or extracellular matrix, and the antibody coats the antigen, which is known as opsonization. I had given this example of making whenever we are having some fried thing like a chicken fry or a fish fry. So we use a batter. So we cover the particular thing so that it becomes more tasty and the volume becomes more also. So whenever a person who is selling some fry, so the batter, if it is more, then the actual material will be less. So anyway, that's lighter part of it. So opsonization basically covers, by opsonization means the covering of the antigen by a particular, or coating of the antigen by a particular antibody, so that it can be easily taken up by a macrophage. It becomes more palatable for the macrophage. It can be more easily destroyed by the macrophage. Okay. And there is either a deposition of complement, or there is recognition and attachment of the immunoglobulin or complement by a particular receptor of the phagocyte, that is either Fc receptor or the complement C3b receptor of the phagocyte, which eventually leads to phagocytosis. Okay, so because that is the aim, opsonization is the initial thing. It has to be the phagocytosis by a phagocyte, that is a macrophage. And in complement also, there is something known as this ADCC, antigen derived cell mediated toxicity. Okay, the cellular cytotoxicity leads directly to cell lysis. That is uh, uh, this is forgetting the term. So this is directly activating, and this MAC is an antigen complex. Okay, so this produces some holes on the cells. It's the cells which are the antigens itself, which are the cells which have contained the antigen, and that directly kills, or the cell lysis takes place. So that is called antibody dependent cytolysis. Okay, so this particular thing is very important, you see, because opsonization and phagocytosis are the first type which leads to this type 2 hypersensitivity reaction. But why is the problem? So this is a normal phenomenon. So why the problem happens? Problem is seen when this particular thing is noted with these reactions. So what is the example? Mismatched blood transfusion reaction. So if a person having a blood group A is given a blood group B, is given a blood of blood group B, then there is a mismatch, because A blood group person will have anti-B in their blood. So whenever the B antigens, B RBCs come into contact with the blood, so they will be lysed. So this lysis takes place by the method of the phagocytosis and opsonization. And this is example of the clinical example of type 2 hypersensitivity reaction for this category is mismatched blood transfusion. HDN means hemolytic disease of the newborn. Here also some mismatched transfusion takes place, mismatch between the maternal blood coming to the fetal blood takes place, leading to lysis of the fetal blood cells. Okay, this is AIHA, means autoimmune hemolytic anemia. Here also the RBCs are destroyed because the antibodies produced against the RBCs, they act on the self RBCs. Okay, so autoimmune, as I told you, this immune system, if it produces antibodies against body's own cells, so that becomes detrimental. So autoimmune hemolytic anemia, immune thrombocytopenic purpura. Initially it was known as idiopathic, but now it is known as immune thrombocytopenic purpura, ITP. So all these are examples of production of antibodies against body's own cells by the body's own immune system. So this, if you are asked what are the examples of type 2 hypersensitivity reaction happening in the body, one is the mismatched blood transfusion reaction, which is a normal phenomenon. Actually, if we consider it's a normal, it's not an exaggerated thing. We have done a mismatch by mistake, that is a iatrogenic error. However, this AIHA and ITP, they are true examples where the body's own immune system is showing exaggerated or faulty reaction and leading to hypersensitivity reaction. Another example is inflammation, which is here the reaction is shown by inflammatory response. There the reaction was shown by lysis, phagocytosis initially by after opsonization, and phagocytosis leading to a killing of the cell, lysis of the cells. Okay, here what is there? the inflammation is there. Inflammation means the inflammatory response is there. We have studied inflammation, we have studied acute inflammation, we have studied chronic inflammation. This inflammatory reaction, if it is exhibited in a particular hypersensitivity reaction, this is the example. How it does? Antibodies are there, are produced against fixed tissues, fixed antigens in the tissues. Okay, this is an altered and this is an altered immune response. You see, the fixed tissues are the body's own tissues, that is the basement membrane, the extracellular matrix. These are the body's own tissues. If by faulty immune reaction antibodies are produced against them, there is activation of the complement system. There is a complement, there is a classical pathway, there is an alternative pathway. I'm not going into details of that. We will be discussing that whenever we are going to discuss the production of immune reactions. Okay, so we will be discussing later on, not now. So complement activation is through the C5a and C3a, and through whenever the complement C5 is activated, the inflammatory response is generated, the neutrophils and the monocytes are activated, and C3 activation leads to increased vascular permeability, which is also a part of inflammatory response. The first reaction of the vascular system was initially the initial vasoconstriction, followed by vasodilatation and increased vascular permeability. We have studied in inflammation, and here there is these neutrophils and monocytes. They are also activated by C3b and Fc receptors. Okay, finally what they lead to? They lead to this production of prostaglandins, vasodilator peptides, lysosomal enzymes like protease. Similarly, like what happened in type 1 reaction, also here also these enzymes are produced, but they are produced by these cells, not by basophils or mast cells. They are produced by these neutrophils and monocytes. Okay, neutrophils and monocytes, they are leading to these reactions, the enzymes, lysosomal enzymes, proteases, okay, reactive oxygen species. And finally, as you know, these lysosomal enzymes, the proteins, they will lead to the digestion of the tissues and continued inflammation. Okay, if the antibodies are being produced by the body's own tissues, naturally the reaction will not stop, because the body has the body has lots of own immune own antigens. Whole body is full of antigens, so a particular antigen, if it is destroyed, the body will again replenish it. So this antigen inflammation reaction keeps on going on and on, because body tries to replenish it and the inflammation keeps on continuing. Okay, so this is a very uh, and this example is a very good example of autoimmune diseases. So one of the autoimmune diseases is vasculitis. The antigen is the blood vessel basement membrane. Okay, the antigens are attacked upon by the antibodies produced by the body's own cells. Another example is Good-Pasteur syndrome, where the antibodies are produced both against the basement membrane of the kidneys, glomerulus, as well as the pulmonary capillaries, and also in acute rheumatic fever, which is a disease, which is autoimmune disease, in which antibodies are produced against Streptococcus beta hemolyticus, group A beta Streptococcus. So that antibody cross reacts with the own antibodies, that is the antibodies of the heart muscles, antibody of the other joints. So that becomes culminated into a acute rheumatic fever. Okay, so whenever you are asked example of type 2 inflammatory hypersensitivity reaction where inflammation is the predominant thing, so you give these examples: vasculitis, Good-Pasteur syndrome, and acute rheumatic fever. The third or the last category is antibody mediated cellular dysfunction. Okay, so antibody leading to cellular dysfunction. So here what it does, the antibody which is produced against body's own cells. Okay, there is no cell injury or inflammation. We were discussing of the first was the cell injury. Here the cell which was their body's cell, own cell, was phagocytosed. The classic example was immune hemolytic reaction, that is autoimmune hemolytic anemia, and ITP. So body's platelets, the platelets are the body's own cells. So antibodies were produced against the platelets. The antibodies covered the platelets, opsonized them, and were eventually phagocytosed or killed. So that was how this ITP, and that led to reduction of the platelets, that is called thrombocytopenia. So ITP was example. Here RBCs were coated by antibodies which were produced by the body's own cells and phagocytosed, lysed, and eventually autoimmune hemolytic anemia happened. That was opsonization phagocytosis. This was inflammation, where inflammatory response was generated by the antibodies against body's own antigens. And last one is the antibody did not lead to either cell injury or inflammation, but led to something else. What is something else? That the antibody blocked the receptor at the motor plane. This ACH receptors, this acetylcholine receptors, which were blocked at the motor end plate, led to weakening of the response, the neurologic response, that is eventually a neural response leads to contraction of muscle. The muscle, if it is not the muscle cannot contract, so that muscle will become weak. In myasthenia gravis, that is what it happens. So this antibody which was produced against the ACH receptor led to reduced contraction of the muscle, that is the neural transmission was blocked. Okay, the ACH or the neural substance which is responsible for the eventual muscular contraction was blocked at a particular synapse and the muscle could not contract. So that is the basis of myasthenia gravis. So it is blocking. The reaction is blocking and reduced activity. On the other hand, in Graves' disease, the antibody stimulates TSH receptors. The TSH receptors are stimulated. Thyroid stimulating hormone, they are stimulated. The TSH, what it does, it produces more, it leads to more production of the thyroid hormones, that is the T3 and the T4. Okay, thyroxine and triiodothyronine, you have studied in biochemistry, physiology. So these TSH receptors, if they are stimulated somehow, excuse me, they stimulated somehow, they lead to more production of these thyroid hormones. But normally when it happens, when the thyroid hormones levels are low, then only TSH receptors are stimulated, then only more production takes place. But these antibodies, if they simulate the action of TRH, that is thyroid TSH receptor activator, then this continuous stimulation is taking place. So this is an autoimmune reaction. This is an autoimmune reaction. It is not a desired reaction. It is an autoimmune reaction where the antibody wrongfully stimulates the TSH receptors on the thyroid follicular cells to produce more of these hormones, leading to a condition known as Graves' disease or thyrotoxicosis. Okay, so these are the examples of type 2 hypersensitivity reaction. So we have discussed today type 1 and type 2 hypersensitivity reactions. And if you have any queries, As I told you, you can ask, because immunity is not a very easy topic. From the very beginning, I am telling you, you have to read it at least 3 times to understand immunity very clearly. And as I told you initially also, and as I am telling, I keep on telling my students, please have a habit of writing down, make your own notes. These lectures are only supplementary things. You have to be, everything is given in the books, things are available in the internet. We only supplement your knowledge, but ultimately you will have to understand it. If you don't understand, of course we are there. If you have to understand it, and you have to write it down in a simplified form for you to remember. Eventually the whole thing has to be grasped. You have to understand from the basic thing, and you have to have a total knowledge of the immunity, because it's, I am again telling you, immunity is one of the most difficult topics. Why? Because you see, the not the small example will tell you that on this immunity only there is a DM course, that is this doctorate of medicine. After MD medicine, people do DM in rheumatology, and rheumatology is a not nothing but a branch of immunity. Okay, so you can understand the whole thing, the rheumatology whole disease. The 3 years DM course just revolves around this immunity only, the treatment, the understanding of the disease, and all those things. So that's why I'm just trying to emphasize this fact that please try to have a good understanding of immunity. It will be helpful everywhere, in microbiology, in your understanding of this pathology topic, and also later on in medicine. Thank you so much.
Thank you, Dr. Palash. Very well explained. And indeed, immunity and immunology is a very important subject. One needs to understand that, and for that, one really needs to look into it more deeply. We have finished type 1 and type 2. I think in the next lecture, we will take up the rest of the hypersensitivity system. Right,
Yes,
thank
sir.
you so much. Right, if there are any questions, we'll ask everybody to post it on the Telegram group. Right. Thank you then. Take care. Bye bye.
Thank you, sir.
Thank you. Bye.